Y'all know what time it is? I said, do you know what time it is? It's time for KP's Video News. That's right, KP's Video News. KP's Video News. That's right, it's time for KP's Video News. And we always got the latest updates, and these things I'm going to talk about here today are very, very important. And these are some things that can't be swept under the rug, and they can't be taken too lightly because it affects you. Okay, the leader of the World Health Organization lashed out Monday at two French doctors' apparent suggestion that the coronavirus vaccines be tested in African nations. And he stated Africa cannot and will not be a testing ground for any vaccine, said the Director and Attorney General of the World Health Organization when asked about last week's televised remarks. To be honest, I was so appalled, he said, it was a disgrace. Appalling to hear that the 21st century, to hear that from scientists that kind of remark. We condemn this in the strongest terms possible, and we assure you that this will not happen. The hangover from a colonial mentality has to stop. Let me read that again. The hangover from a colonial mentality has to stop. Tedros was speaking during his daily briefing on the global pandemic, which has infected well over 1 million people worldwide and likely killed 75,000, according to the latest tally from Johns Hopkins University. The racism accusations stem from a television interview Friday in which two French doctors discussed the efficacy of vaccine testing in various places. While they had talked about trials about to launch in Europe and Australia, they floated the idea that a vaccine's effectiveness would be revealed more in places where there's less personal protective equipment, PPE, available, such as Africa. If I can be provocative, shouldn't we be doing this study in Africa where there are no masks, no treatments, no resuscitation? Said Jean-Paul Myra, head of the intensive care at Cochrane Hospital in Paris, according to BBC News, a bit like as it is done elsewhere for some studies on AIDS and prostitutes. We try things because we know that they are highly exposed and that they do not protect themselves. We are in the process of thinking about a study in parallel in Africa, answered Camille Locke, head of research at the Inserm Health Research Group, referencing the European and Australian trials. The doctors were specifically referring to a widely used tuberculosis vaccine that may have potential against the coronavirus. The quotes drew immediate backlash, and the doctors have since apologized for the clumsiness of their remarks. Not the deadliness, now, this is a sidebar, not the deadliness of their remarks, the clumsiness of their remarks. In other words, they just apologizing because they got caught. The damage had been done. The remarks spawned hashtags such as Africans are not lab rats and Africans are not guinea pigs. Renowned soccer player Drogba roundly condemned the remarks. Africa isn't a testing lab, he said. I would like to vividly denounce those demeaning, false, and most of all deeply racist words. Help us save Africa with the current ongoing COVID-19 and flatten the curve. And that was a soccer player that said that. There is already massive distrust in African countries handling about the coronavirus. Recently, protesters in the Ivory Coast destroyed a testing center that was under construction, tearing it apart with their bare hands. That's right, tear that sucker apart because you don't know what they're going to do. And so not only is this testing and this stuff going on in Africa, what they would like to do in Africa, take that back, let me backtrack. What they would like to do in Africa, you got to think about what they're doing right here in the United States, in Detroit, with their massive numbers, and in Chicago, where they have their massive numbers. And having said that, I'm going to go on to my next story. Here. And which I'm just leading off into this next story, and it's this story here is another one that will should highly upset you. It says that African Americans may be dying from the coronavirus at a higher rate. Better data is essential, experts say. So, in Chicago, it's in Chicago, Illinois, and I just recently found out that I have a family member that's been infected with the coronavirus. God bless him, and I hope he makes it through. And this person works at a hospital, and I'm praying for you, cousin. He works at a hospital, and he caught the coronavirus at work. Anyway, in Chicago, a recent report found that 70% of people who died from the coronavirus, the disease caused, are black. Even though the city's population, 70% of the people who died from the coronavirus are black, but the city's population is only 30% black. In Milwaukee County, which is 27% black, the figure is 81% of the people that have died with the coronavirus, and the population is only 27% black. And public health officials tracking the coronavirus have seen similar disproportionate impacts on African Americans in Philadelphia, Detroit, and other cities. But just how widespread the disparities might be across the country is difficult to know, because most states and federal government haven't released the demographic data on the race or ethnicity of people who tested positive for the virus. That's created an information gap that could aggravate existing health disparities, prevent cities and states from equitably distributing medical resources, and potentially violate the law. Civil rights laws prohibit federally funded health care providers from administering services in a discriminatory manner. Oh boy, director from the Lawyers Committee for Civil Rights Under Law, which joined with medical professionals Monday to call for the immediate release of racial and ethnic data on coronavirus infections, testing, and deaths. Our ability to fully understand and confront this pandemic requires and demands that we obtain racial data now. Some Democratic lawmakers have also pressed the federal government to release the data. Advocates say the lack of information makes it impossible to know where resources are being fairly distributed or whether some groups are getting cut out, notably those like African Americans, who are more likely to have underlying health conditions. On Tuesday, the D.C. Dunce called the impact on the coronavirus on African Americans a real problem that was showing up strongly in the data. Dr. Fauci, director of the National Institute of Allergy and Infectious Diseases, added that pre-existing conditions are more prevalent among African Americans, including asthma, diabetes are a factor. We're very concerned about that, he said. Low-income people of color, black, brown, red, low-income people of color, also more and white people of low income are more likely to have jobs that can't be done remotely, meaning they're more likely to be exposed to the virus, while more affluent professionals are able to stay at home and work. They're less likely to have access to high quality private testing or medical care. I'm concerned that this will be yet another case when there's a huge difference between people who are more wealthy and people who are poor. And there's going to be a difference between people of color and how much they suffer. We have a long-standing legacy of bias and racism in our country, and we're not going to get beyond that quickly. The Centers for Disease Control and Prevention has included age and gender in the flood of data that is released daily since the pandemic. The agency hasn't released racial or ethnic data and didn't respond to a request for comment. Most states and territories have released racial and ethnic data. Most states and territories haven't released ethnic and data either. And it said only 9. Connecticut, Illinois, Louisiana, Michigan, Minnesota, North Carolina, South Carolina, Virginia, and Washington, D.C. are the only states out of 50 states that have released the information. That's only 9 states. only 9 states are releasing this ethnic and racial coronavirus information. The rest have either struggled to gather the information or have raised concerns about the reliability of data collected under less than ideal circumstances, such as drive-up testing centers or hastily built medical tents. Race is an area of data where we have challenges with to begin with, and it's going to continue until you do what you have to do to protect yourself and stay inside and avoid contact with people if you go out. You know, it's a whole lot of videos on YouTube that show you how to make your own mask. How to make your own mask just by folding them up. You put a little rubber band on the back of it. Boom. This is just a fiber cloth, a fiber towel. You can make them out of whatever. And put you a couple of rubber bands on the end. Put those around your ears. Fold it over. Boom. You got yourself a homemade mask. So you can do these things. And I can't say it enough. Don't forget to put something in your ears too. Cotton balls or something in your ears, the earplugs or whatever you can put in your ears to keep stuff from getting in your ears. To finish this off, it says really important to underscore that this virus is rapidly moving infectious virus, and that it's crucial that everyone understand that they are at risk. Everyone must understand that they are at risk. This isn't a virus that is only impacting just certain groups. It's impacting everyone. But at this time, the numbers and the data that is out there are reveal that it's really, really big in the African American community and the low income people, Black, Hispanic, Native American, Southern whites in those rural areas. So it's prevalent because these people don't have access to better health care. Okay, here moving on to story number 3. We have a mayor ordered police to crack down on social gatherings. This is the hypocrisy that's going on. The mayor of Alton, Illinois, ordered police last week to issue citations or arrests at their discretion for people violating the state's stay-at-home order. After officers reported that people were continuing to defy the rules, the mayor said he had directed the city's police department to use its discretionary powers to issue the citations and arrests. These are very serious times, and I'm begging you to please stay at home. Bryant Walker, mayor of Alton, Illinois, said in a briefing on Friday. Less than 48 hours later, police broke up a gathering at Hiram's Tavern in downtown Alton. Among those in attendance was Mayor Walker's wife. Walker announced in a statement that police had investigated and stopped the social gathering in violation of Illinois statewide order around 1 a.m. on Sunday. He said the police also informed him that his wife was there, and he claimed he instructed the police chief to treat her as he would any citizen violating the stay-at-home order and to ensure that she received no special treatment. Yeah, I'm not believing that. The mayor said he was embarrassed by his wife's actions. And so Alton police confirmed to CNN that officers issued a criminal complaint for reckless conduct, a Class A misdemeanor, charge punishable by 364 days in jail and a fine of $2,500 to everyone who gathered at the bar. So all of them got fined $2,500. And so the mayor said, my wife is capable of making her own decisions, and in this instance she exhibited a stunning lack of judgment. Walker said now she faces the same consequences as her ill-advised decision as other individuals who chose to violate the stay-at-home order during the incident. So yeah, let's see, got to keep an eye on that one to see if they throw her case out and just let everybody else stay in pay their fine. She had a $2,500 fine or either a year in jail. All right, on with the last story with this segment, and I'm just going to give you a brief piece of it because I'm going to come back and touch harder on this one. The company Novartis, which is the company that the DC dunce was spouting out the other day at his little rally on TV, was talking about how, you know, this company was going to be making like billions of hydrochlorine pills. The pills that they're talking about, they're supposed to be good for fighting the coronavirus, even though there has been no study and no direct information stating that that's true. Now we're finding out why. Novartis, the company that Trump was talking about, paid Cohen $1.2 million for work it says he was unable to do. So I'm just going to give you a brief part of it. The pharmaceutical company Novartis acknowledged that it paid Trump fixer Michael Cohen made over $1 million starting back in 2017. In February 2017, shortly after the election of President Trump, Novartis entered into a one-year agreement with Essential Consultants, and Novartis said in a statement Wednesday, in a second statement regarding his agreement with Cohen. With the recent change in administration, Novartis believed that Michael Cohen could advise the company as how the Trump administration might approach certain U.S. health care policy matters, including the Affordable Care Act. Fast forward to today, and this company is the same company that Trump just issued out a government contract to make all these untested hydrochlorine pills that he's been running his mouth about. Oh yeah, if you take these, they're gonna help you with cure the coronavirus, blah blah blah. And it's an outright lie. But now we understand why he's trying to do this, because of course he's going to make money off of selling you these bogus pills that don't even work. So people, you know, you come out better by going to get 50 gallons of orange juice and drinking that rather than dealing with this crap that this idiot's talking about. I'm telling you, man, this dude is just like it's watching him. It's just like watching the cartoon, man, with the Tasmanian devil. The Tasmanian devil, man, is just be spinning, and he's tearing up stuff off. Every time he just tearing shit up everywhere he goes. That's what this guy's like. He's like destructive. He's just destroying everything. Everything he touches turned to crap. So I'm not taking. You take the pills. I'm not taking them. So that's KP's video news for the day. KP's video news. Who? KP's video news. Peace.